Thank you so much. I think I will start by giving the warmest greetings from our Executive Director of UNAIDS, Winnie Byanyima, who would have loved to be here in Dublin these 2 days, but was unable to, and so here I am. It's an absolute pleasure for me to be here. My first time in Dublin, so this is really a pleasure. And thanks to Nadine and her team for the invitation, and all protocols observed. Okay, so I've been asked to speak a bit about human rights and HIV in the context of health equity. So I think it's important to recognize the moment that we're in. We are in a moment, as many people have said, of many crises, many humanitarian situations, wars, and so on. And the AIDS pandemic continues to be at the forefront. As 40 years on from the early days of AIDS till today, we've made much progress. But we also know that we are not on track to reach the goals that we set in our own AIDS strategy as well as the SDGs. And I think it's important to recognize as well that there is a lot of progress in SDG 3.3, which deals with HIV, but we have a long way to go, and global solidarity is very critical at this moment. And I was happy to hear the words spoken by Anne Nolan this morning on this point. 40 million people continue to live with HIV, and the new infections are not declining in many parts of the world. In fact, in Eastern Europe and Central Asia, Middle East and North Africa, as well as Latin America, we're seeing increasing infections. So whilst there's been much focus and attention and resources in the African region, and we've seen those new infections go down in general, not so in the rest of the world. And again, we have to recognize that there are many, many deaths that are avoidable, and I'll talk about how we should be doing that. Some key messages from UNAIDS in our last Global AIDS Update report released in July at the Munich conference. The calls that we have made are to invest more in ending AIDS. So we have seen increasing investment from many countries, including Ireland, but we continue to be short of the necessary resources. We need to have access to new innovation. As we say, innovation without impact is just a good idea. And we need to see that impact through seeing access to the most cutting-edge technology, including medicines for treatment and prevention, and ensuring that game changers like lenacapavir are accessible and available to young people especially, and to young women and girls, as well as gay men and men who have sex with men, some of the and other key populations. We have spoken a lot at UNAIDS about the inequalities in access to innovation. During COVID, we spoke very loudly about the kind of parallels between HIV and access with the COVID vaccines that were not available in much of the world where COVID was claiming many lives. And of course, protecting human rights is essential and is at the center of the work that we do at UNAIDS, and I'll talk more about that. And lastly, global solidarity is necessary and critical as we move forward responding to HIV. So my call is that we must keep HIV on the global agenda. Sorry, I'm a lawyer, so I use a lot of words. So I'll go through this quickly, though, so we can get to some of the maps and other interesting data. So I would love to just say, the work that we do in my part of UNAIDS, which is on equality and rights for all, is around really focusing on gender equality, community leadership, and protecting human rights as part of a centrality of the HIV response, and including in the programming, in the science work that we're doing, and the responses in country. But we also are seeing a great deal of stigma and discrimination. And as Delroy very eloquently said this morning in his poem, there is a lot of fear. People are scared to access health services and are being sent away from services instead of being brought into services, which is exactly what we need. So we need to respond to the societal enabler targets, and we are very much not on track. And of course, very central to the work is to support communities in the research, advocacy, monitoring, design, and delivery of services. Communities have demonstrated that they must be at the center of these programs, and that they are essential to protecting the human rights of the most vulnerable. So when we talk about inequalities, I think criminalization that we see around the world, particularly against key populations, people living with HIV, and adolescent girls and young women, is really key. And in sub-Saharan Africa, 3,100 adolescent girls and young women were infected with HIV every week in the African continent. And 77% of new infections are with young women. 77% of people living with HIV are on treatment, but only 57% of children have access to treatment. So there's a great inequality when it comes to children that we must focus on our attention on. Other inequalities like violence, stigma and discrimination, harmful laws and practices really sabotage the ability of adolescent girls and young women to protect themselves from HIV. And that's why one of our programs, the Education Plus initiative in Africa, is so critical, because it empowers young women and girls to go to school, get an education, and the evidence shows that this reduces their vulnerability. We continue to see HIV criminalization in many countries, and I'll show you the maps. But we know that the evidence shows that this does little to achieve public health objectives and results in many people deterred from services. So what does this look like from a global perspective, these inequalities? 13 countries have laws that specifically criminalize transgender people. And I know this seems like a low number, but we know in many societies transgender people are invisibilized, and therefore the data is simply not available. So we need to ensure that these policies and practices that invisibilize people are removed, and we will see these numbers change significantly. 156 countries still criminalize HIV, non-disclosure, exposure, and transmission. You'll see most of this map is red, which shows that many of these countries do criminalize some aspect of these areas of HIV, non-disclosure, exposure, and transmission. And as you know, women are more likely to know their status, and so they tend to be the most penalized by these kinds of laws because they know their status. And many people then avoid even knowing their status, let alone getting onto treatment. So this needs to shift in terms of the enabling environment. 63 countries still have laws that criminalize same-sex sexual acts. And we're talking here about adult consensual sexual activity. You'll see that much of the African continent is red or pink, which means that some of these are the old colonial laws. You know of these. These are the sodomy laws that criminalize same-sex activity. And recently, we have seen more of these laws, more punitive laws in countries that I will speak about later on. But this is an area where UNAIDS is doing much work to turn this around. And I must say that the trend is towards decriminalization, but obviously there's still a third of countries that still criminalize. And of course, This is almost entirely red. This is the countries that criminalize the possession of small amounts of drugs. And we know the linkage between people who inject drugs who are most vulnerable to HIV, and they don't have an enabling environment where they can access services and treatment and not be treated like criminals. So what does this look like in some countries? In my team, we've done an analysis of some of the most recent laws and bills that in the last couple of years have been tabled in parliaments in Kenya, Ghana, and Uganda. And you know that the Uganda law was actually passed last year and was immediately challenged by civil society, and UNAIDS submitted an amicus brief that I can talk about later if there are questions on that. So what do these laws look like? Who is actually criminalized? Mostly it's LGBTQ people, and in all aspects of their lives. So in the workplace, in accessing healthcare services, in accessing social development, in education, in all aspects. We're also seeing, obviously, the private adult consensual sex criminalized. And in Ghana, the bill, which is not yet passed, criminalized merely identifying as an LGBTQ person or an ally of such a person. So that's a lot of people who are criminalized. What is the conduct? So same sex, as well as the kinds of advocacy activities that all of us are either engaged with or support. So it's the activists who are trying to support their communities, delivering services at a community level. Those activities are criminalized. SRHR and comprehensive sexuality education are really central to these laws. And we've seen, for example, that even the mention of abortion rights in the Kenya bill is criminalized. CSE is criminalized. Sexual orientation, you'll see that there is no recognition of any gender beyond the binary. Everything else is criminalized. Sex reassignment and gender-affirming surgery, you'll find that both the patient and the health provider have criminal penalties. So this would result in an actual criminal trial, conviction, and jail time. Some of these countries also have the death penalty, and this is being applied in the context of LGBT people. The Uganda law talks about aggravated circumstances in which the death penalty applies. The duty to report is also really central. In our amicus as UNAIDS in the Uganda case that challenged the Anti-Homosexuality Act, we talked about the need for health providers to be able to have the trust and confidentiality of their patients, because that is the trust in the public health system itself. And in fact, that provision requiring people to report LGBT people to police was struck down by the court. So what are we doing? Some of the programming that we're doing, in addition to working on these issues in the countries that I've just spoken about, the Global Partnership for Action to End All Forms of HIV-Related Stigma and Discrimination. This is a political commitment made by countries together between governments, private sector, civil society, and other stakeholders to address HIV-related stigma and discrimination and turn this into real action on the ground. I've spoken about the amicus curiae intervention that UNAIDS did. We intervened in that case because, in particular, we have the evidence of the public health consequences of these anti-homosexuality laws, and that's what we put before the court. The court actually struck down the criminalization of HIV transmission, which is a core part of our brief, as well as the duty to report people to police was also struck down, which was central to our brief. The UN also, we actually launched together with UNDP a guidance to UN agencies everywhere to prevent and respond to HIV-related human rights crises. This is central to understand that the UN has a role in defending human rights, in protecting vulnerable people, and ensuring that we have a public health response that is based in human rights. We also have done work, including at the Human Rights Council just a few months ago, the HIV and Human Rights Resolution. We worked very hard. This is an important part of UNAIDS's role, our diplomatic role, in ensuring that countries make commitments around human rights and HIV. And here we had the first unqualified recognition of sexual and reproductive health and rights in a UN resolution. We also call, the resolution itself also calls for CSE and significantly calls for the removing of punitive laws and policies. And this is an important tool for civil society organizations and countries to ensure that governments are actually meeting the requirements and obligations based in the resolution. And I must say the anti-rights and anti-gender movement is operating in these spaces, these multilateral spaces at the UN, at the Human Rights Council. It was a real fight to even retain some of the human rights language that has previously been agreed. And we were able to do that work and get consensus on that resolution, which I think is really critical. There are other initiatives like the Global Prevention Coalition that also centralizes human rights in the prevention response, and of course the Global Alliance to End AIDS in Children. I'll just say that the Global Partnership is a real important initiative of UNAIDS, and you will see in this map that we have almost 40 countries that have made this commitment to end all HIV-related stigma and discrimination. And since we're in Europe, you'll see that Germany recently joined, made the announcement at the AIDS 2024 conference, and we would love to see Ireland highlighted there and to see that commitment in this partnership. And I think what's central to this partnership is the sharing and learning that we're able to do between and amongst countries, where countries that are far behind on addressing human rights and stigma and discrimination can learn from innovations in other countries and really shift towards our targets. I also want to highlight the wonderful partnership that we have with Beyond Stigma that also falls under the global partnership commitments. And we know that the stigma index shows that internal stigma is significant and growing. And we really want to address this. And one of the partnerships that we have with Beyond Stigma and GNP+, the global network of people living with HIV, really tries to address this in several countries, and we're hoping to expand on this should we have the resources, because as you know, human rights is always the least funded, the most important in my view, but also has some of the most passionate people working in this area. And I'll just end by talking about the real lack of resources. We know that we are $2 billion short of addressing the societal enabler targets. And much of the funding is actually international funding. So we need to see more of national funding in the area of human rights and societal enablers. In some countries, we see much of the HIV response is funded nationally, but human rights isn't. So that's always left behind. So we need to get more commitments, more political commitment around human rights and HIV. And I would like to thank everybody for listening to me. Much appreciated. And thank you so much. I'm available for questions.